My kids and I use Invisalign retainers. How do you feel about the plastic in our mouths for 8 to 12 hours a day?
There was a study done in 2024, and the study found...
How would you approach treating long COVID-induced dysautonomia?
This is something we see in clinic a lot.
When you say a few snakes a day, what type of snake are we talking about? Garden? Tropical forest?
When we talk about bowel movements, Dr. Cole says regularly 2 to 3 snakes a day. So for those, we now want to know, what does this snake look like?
You're never going to look at a snake the same way again.
Dr. Cole, what's your opinion on peptides? Are they really worth the hype?
Are they worth the hype? What's up, and welcome to The Art of Being Well. We're giving away free healthy stuff, guys. We're giving away free telehealth consults with the functional medicine team. We've been doing this for over 15 years, if you didn't know.
Mm-hmm.
We're the OGs.
We are the OGs.
Often imitated.
Never replicated.
Never duplicated. Does anyone know what this reference that is? It was like a 90s R&B song.
I wouldn't know.
We're not getting into that.
All right. We're giving away free signed books. We're giving away, you can pick which one, like gut feelings, intuitive fasting, ketotarian, or the inflammation spectrum. And we're giving away free supplement protocol stacks that we have at drwillcole.com. It's the Art of Being Well line. We have hormone support, gut health support, brain health support, different things. So you can check out which one you want if you win over at drwillcole.com. Anyways, for a chance to win any one of those, you can head on over to Apple Podcasts and rate and review The Art of Being Well there. Tell us what you love about the show. You can leave your Instagram handle in the Apple Podcast review itself, or take a screenshot of your review and message me on Instagram at Dr. Will Cole, and then the team will go through the messages on Instagram as well as read the Apple Podcast reviews themselves. Honestly, thank you. I read them as well. They're very kind and sweet and thoughtful. And yeah, we love doing the podcast for you all. Anyways, they'll randomly pick winners from the Instagram messages and reading the Apple Podcast reviews themselves. And then we'll reach out to you if you win. And then you can tell us which one you want. And we'll get you scheduled for the telehealth consult, or we'll send out the books or protocols.
Yeah.
And about twice a month, we have these entire episodes devoted to your burning health questions. So submit them. You typically submit them. We have a massive Google Doc. You submit them by emailing hello@drwillcole.com. You can still do that if you're super shy, but I have some exciting news. We are going to start playing your recorded voice messages with your health questions that you are leaving on this voice message. Super exciting. You can hear your voice.
I'm very excited
on
about
the
this
podcast. You can get our hot take on your questions. It could be about your own health issues that you're looking to optimize. There could be about some study that you read about that you wanted the context around it and how we would interpret the data, the health research study, or it could be some trend that you saw on social media as far as health and wellness and nutrition. So all the things that you know and love about these Ask Me Anything episodes, you can record, leave me a voice message, and then I'll play it on the podcast. To do that, you go to speakpipe.com/Dr. Will Cole. Again, that's speakpipe.com/Dr. Will Cole. Super easy. Just press record when you go to that URL and leave me a message. And then we'll get to as many of them on these Ask Me Anything episodes.
Super fun.
Yeah.
Very exciting.
Yeah.
We want to hear your questions, so keep them coming in. All right, so to help me out every Ask Me Anything episode, we have 2 brilliant members from my functional medicine team. They're functional...
Brilliant.
Yes,
absolutely brilliant.
Functional diagnostic nutrition practitioners. Then Sam walks in here. You don't see her on camera, but she's on our patient experience team. And she's... anything you want to say to the people, Sam? Have a great episode, she said. She's just checking cameras and things like this. Okay, so anyways, Emily and Andrea are here every Ask Me Anything episode. They're on the clinical team with me. We help people around the world get healthy, so you can have sort of a diverse perspective. Sometimes we have different perspectives. Sometimes we're all in alignment, but you're still going to get different maybe things that the other one's not thinking about, but you'll get a well-rounded perspective.
Yeah.
Oh, yeah. It's kind of like if you were in office with us, this is what it would honestly really be.
You get the behind the scenes when we're talking over what type of labs or what type of supplements would we recommend? How would we care for this person?
That's it. Yeah. And that's great for any clinical team. It's called refinement, right?
Exactly.
It's refining and makes the protocol, the experience, the care, the best it can be.
Yeah, you have multiple people
Absolutely.
who have your best interests rather than just one person and their own limitations.
Yeah, it's true. All right, so
It's me. I'm up first. Sorry, I wasn't ready. I really appreciate when we'll be able to play this question. All right. So question number 1, they said, my kids and I use Invisalign retainers. How do you feel about the plastic in our mouths for 8 to 12 hours a day? I thought it was all day other than when you brush your teeth, but maybe I'm wrong. And what are the least toxic ways to clean them? Is Zima Dental, etc. okay? Specifically, are the cleaning tablets okay to use for the long term? Really, I think there's multiple parts of this. 1, how do you feel about the plastic? And then also, how do you clean them and clean them well?
yeah, so I had someone else, interestingly enough, ask about plastics with IVs. Just the other day too. So
Yeah.
people we've talked a lot about on the podcast, and I think maybe that's why people are asking, is just
Right.
our exposure to microplastics and forever chemicals, PFAS, that are a component to many microplastics. So, so what's the science show? What's the context around Invisalign, these sort of, what would you call them? Like
Braces?
brace alternative, like a
Yeah.
braces
Right.
alternative.
Yeah.
And night guards too could be put into that category.
Oh, yeah, because you're chewing those if you're grinding your teeth, too.
Yeah, right.
Yeah.
So it's the study show. Let's look at PFAS, which are forever chemicals, and then also the microplastics. So they're oftentimes can be part of the same problem. A lot of plastic products have forever chemicals on it, but they are 2 separate, distinct issues as well. PFAS, there was a study done it was a 2024 study, I believe. Yep. Yep. The study was assessing potential human health and ecological implications of PFAS from leave-in dental products. And the study found that the night guards had concentrations between 3 and 4 and 7 and 16 of these PFBAs and PFOAs, which are plastics, right? These are these different compounds. No PFAS were detected in whitening trays. So they tested whitening trays and these night guards, which are the 2 ones in this specific study that was assessed. So to repeat myself, the night guards did have levels of these PFAS. The whitening trays did not. The study suggests potential oral exposure from prolonged contact with these dental products, though the contribution to overall PFAS intake is likely limited compared to other sources like contaminated water. We've talked about different products that are household products, the kitchen with like nonstick cookware, the Teflons. I think that's a lot of the nonstick stain resistant things that we have and wear, even like athletic wear, leggings, like yoga
Sports
clothing,
bras,
sports
Right.
bras. That's probably, according to what the researchers are saying, way more likely to be contaminated with these, but it's still a source. It's still a source. Microplastics, a study that was done that looked at plastic retainers, which is what you're basically looking at with Invisalign, right?
Yeah.
Often made from materials like polyurethane or acrylic, may shed microplastics during use, which could be ingested or even lodged in the gums, was postulated in this one report.
Okay.
And we know these microplastics and PFAS, they're linked to oxidative stress, linked to inflammation, they're linked to a lot of different chronic inflammatory problems, fertility issues, autoimmune problems, heart attack and stroke, cancers. So more studies need to be done in the microplastics. And I think that's when you're using anything with plastics, especially in your mouth on a consistent basis. And like
Right.
Andrea mentioned, bruxism, like the grinding that's happening, the teeth grinding of why people wear some of these night guards at least, right?
Well,
It's-
even jaw clenching during the day.
Right. It's this constant wear and tear on the plastics. Yes, you could have these little micro sheddings that you're consuming. So at the very least, to be maybe err on the side of caution, but not be hyperbolic about it, I think would be replacing them consistently over time, so they're not degrading over time.
Yeah.
That's, I think, a middle ground approach, because people, look, plastic makes our life very convenient, but it comes with a cost, right? And you can get better for you options out there, but we're very behind as a society as far as providing people, like, the amount of stuff that we use plastic.
Right.
It is, a lot of it's, the dental world is notoriously very behind.
Yes.
And in many other spaces too. I'm not just picking on dentistry, but it's in many other spaces. They're just not up to the health implications and the environmental implications of things like plastics.
Yeah.
So that's, as far as the studies are concerned, that's what it shows. But what do you take?
I mean, that would be my first assumption, right? Is that you're putting plastic in your mouth, you talk, you are you're going to be moving your mouth pretty regularly. There's going to be some degrading of that material. I mean, you wouldn't put a plastic spoon in your mouth and chew it all day and think that that was good for you. And
True.
The one caveat that I will say, to just play devil's advocate for a moment, this is meant to be temporary. It's not meant to be a forever thing.
Well, night guards aren't.
Well, night guards, Invisalign.
You're right.
It's meant to correct. It's meant to be something, and a lot of times they can do the metal retainers and things like that behind the mouth, but then they're in there.
Is that good though?
Well, they're in there with glue. And so
Right.
then there's you're right, dentistry, but again, they're looking for materials that don't and do withstand, because I mean, our saliva, the enzymes in our mouth, I can only
pH.
imagine what's breaking down in there.
True.
All the time.
Right, because it's not just the teeth grinding, it's the actual pH of the mouth.
It's all of that. It's your enzymes. I mean, we know digestion starts in the mouth. So even though you're taking out your Invisalign when you're eating, you are essentially producing a negative environment for anything. It's meant to break stuff down. That's the whole process of it. Again, I think that there's a lot of components to it. It's, again, meant to be temporary. It's meant to be, something that is only for a few short months. Now, the night guards are a completely different thing, but I think about my kids and their sports and how they have to put their mouth guards in all the time. They're out there, they're definitely chewing on those. They're definitely stressed out there on the field. And so for me, it's just, can someone really way smarter than me make something that isn't going to make me or my kids sick, but really can get us the end goal of what we're looking for, which is better, healthier teeth, which again leads to better and longer life, but isn't going to compromise in the meantime while we're using it. I don't know if there's a better alternative, and that's the hard truth that we're in right now.
We've even had patients who've asked about the cleaning agents and the better alternatives there too, just because some of the
that was kind of within her question.
the cleaning agents are so harsh too on the oral microbiome itself as well. I mean, it's kind of the same way with mouthwash, right? As to how that's not helping our oral microbiome thrive. Some of these cleaning agents are the same and doing the same. So
I've never had braces or Invisalign.
Me either.
So
have
it's
you
not
had braces?
Yeah, so it's not something I've ever had to navigate, but I would assume there's a lot of decent things you can even make on your own with baking soda,
I was just gonna say,
peppermint
baking soda
oil.
wash. Yeah.
I would think that there was something that you could use.
Yeah.
But
and there's not that this is really the question, but you could use toothpaste, non-toxic toothpaste to clean out
you can
a
scrub
mouth
it.
tray. I like Revitin. I had Dr. Jerry Cotola on the podcast. I like Fig, who's Dr. Stacy Whitman on the podcast. A lot of great esteemed biological and functional dentists on the podcast that our patients love these products. We put them in their little swag bags for people, and so that's kind of our take on it. Hopefully that clears up the air, and it's a personal choice, right? We are all exposed to things. It's not about being hyperbolic and fearmonger about every single thing. You can't live in some bubble where you're not exposed to anything. You just have to do the best you can and give the rest to God and be like, what am I being exposed to on a daily basis? What's important to me? What's the benefits versus the risks, and kind of make that personal decision. That's kind of my take on it. I would agree with Andrea that long term, I would want to find an alternative to why do you have teeth grinding? Maybe deal with the stress so there's less teeth grinding. So really look at the bigger picture so you're not dependent on plastic ad infinitum. That would be my
that's my take.
Yeah.
There we go. Next question. Dr. Cole, what's your opinion on peptides? Are they really worth the hype? If so, what are you recommending?
They are they worth the hype? I don't know what the hype's at. What's the hype saying?
Oh, TikTok. My son.
Yes.
It's all these
all over.
bodybuilders. Like some of them are like talking about specific peptides, and so I think it's very easy to get caught up in that world. I will literally walk by my son and I'll hear them like BPC 157, M17. And I'm like, oh my gosh.
Yep.
Like,
Yeah.
you're just cracking
Well, I'm
up.
glad they're talking about it. So if that's what's out there in the world, I think peptides are a great tool within the toolbox. I think there needs to be improved accessibility and more research done on certain ones. Certainly, safety, context, the set and setting with this is really important. But we use them for telehealth patients, and we love them. I've had great success with them personally. BPC 157, I didn't get it because of TikTok, but because of the research around it, it's exciting the way that can really modulate the immune system, lower inflammation in a positive way, speed up gut healing. I went through a stressful time in my life a few years back, and kind of all came to a head. And I have to practice what we teach our telehealth patients. So BPC 157 with KPV subcutaneous was a tool within my toolbox. And then I transitioned to oral. We love a lot of these anti-inflammatory peptides and longevity-based peptides. We utilize them with telehealth patients. I love copper peptides for skin rejuvenation and tissue repair, both topically and otherwise. They could be both inside out and outside in approach. What else? I mean, look, we talked about semaglutide. I think you can't have a conversation about peptides without talking about GLP-1 agonists, and we utilize those for metabolic health. It could be a great tool within the toolbox. These sort of a microdosing approach to GLP-1 agonists, semaglutide, great tool. So, but all of these are going to be best served as a tool within the toolbox. It's not going to be this magic cure-all. It could be a leg up. It could be definitely a needle mover, no doubt about it. But it's like with GLP-1, like we talk about in the podcast, and with patients, it's like, okay, we're not macro dosing and not changing your life. We're actually dealing, what's the smallest amount of these peptides that move the needle as a tool within the toolbox.
Yeah.
So same with BPC 157. You talk about gut health. We're not, like, they're not eating the standard American diet and then just injecting or taking oral BPC 157 and KPV. It's about, what is this going to be a needle mover? Yes, but it's in the context with lots of other helpful, sustainable tools within that toolbox.
Yeah, it's such a compliment to what we're doing in so many other areas too. And so I think it's really important to share that, especially when it's becoming kind of like a health trend. Yeah, is that there are other things, even back to the basics, that really still need to be moved or done too, but it honestly complements it so well. We've had a lot of great success. I mean, I think that we have a lot of patients who could testify to that just as much as we could personally. I love the copper peptides. I have you done any of the BPC or any of the copper peptides?
So I've done the BPC, also stressful periods of my life where it's good to offer my gut the support. Yeah. I did notice. I've never done it subcutaneous, only done it orally. And then I have a blend of topical peptides that I use. My husband, when he did, you guys know, when Alan did that really crazy long hike, I think it's called the Rachel Carson, it's a 37-mile hike that he has to do. He had horrible blisters on his feet. I used that and some essential oils, and within 2 days, huge recovery. Yeah. So I do see, and then I've even used it on scars on my kids, from sports injuries.
Yeah, and that's a copper peptide.
Yeah, it's
Our
copper.
Patients love it.
Yeah.
Yeah.
Yeah. Thymosin alpha-1 is another great one that I love to reduce inflammation. TB 500 is another one that's, again, decreasing inflammation, helping with recovery after injuries. Ipamorelin I love as well. CJC 1295 or ipamorelin is another. It's sort of a big in the anti-aging longevity space. Yeah. So should be assisted with someone that's trained in peptides.
That's what I was going to say is you can find these things, but we use these therapeutically with specific blends and combinations that can be really cool when you're finding kind of the right dosing there, combinations.
Yeah.
Cool.
I agree. Well,
I agree. She loves it.
yeah,
She's
I love
here.
it. I'm
It's a
here for
hype.
it. I wouldn't call it a hype, though. I would just call it a practical thing that we implement
Yeah.
with patients if it's clinically appropriate.
But I think it's a hot trend. I like that it's trending. I like people
I know.
that
Cracks me
that
up.
they're
I'm walking
interested
by
in it.
my kid's bedroom, hearing about
Hey.
some bodybuilder talking about
There are worse
peptides.
things to hear, I guess.
100%.
Yeah, there's great. Yeah, there's definitely muscle building. There's peptides for support of that because what are they? They're modulating the biochemistry. Most of these things are things your body's already making.
Right,
So
right.
it's just kind of assisting the body with getting more ample amounts of these building
But
blocks.
I think the most important thing that we said, this is in conjunction with the other things that we're doing. Like
Yeah.
you don't, like I was
Mm-hmm.
telling my son, like you're not going to take a peptide and you're not going to look like you've done steroids. Like you have to put in the work. You still have to eat well. You have to get enough sleep. You have to treat your body well. And then the peptide is just a supportive adjunctive care to that.
Cool.
All right. All right, Dr. Cole, next question. How would you approach treating long COVID-induced dysautonomia? What are you seeing most success with, especially with those chronic fatigue and neuropathy symptoms such as small fiber neuropathy?
Okay, this is something we see in clinic a lot. People that have different methylation, HLA gene variants, and something triggered an inflammatory response. Something triggered some sort of dysregulated neuroimmunoendocrine axis response. And for years, I mean, we've seen this with different viral issues like Epstein-Barr virus, different cytomegalovirus, human herpes 6 virus. We've seen it with mold toxins, of course, other biotoxins like bacteria and mold, as well as viruses. And then stress, like chronic stress, unresolved trauma is well documented in the scientific literature to triggering dysautonomia as well. So what we're talking about is a dysregulated nervous system. You see people talking about it on social media. Well, that dysregulated nervous system exists on a spectrum. From mild nervous system dysregulation, feeling wired and tired, anxious, exhausted, I can't calm down, all the way to dysautonomia. And POTS is like a part of that. Postural orthostatic tachycardia syndrome is an aspect of that sort of continuum where people have vertigo and dizziness, and they have heart palpitations, racing heart and thoughts as well, and they can't calm down. It's like their sympathetic fight or flight, hypervigilance cannot turn off,
Right.
cannot downregulate, cannot feel safe. So we have to say, well, why is the nervous system so hypervigilant? Why can't it calm down? Well, that initial trigger can be a virus like COVID, or it could be something else, and some environmental toxin, right? And oftentimes it is going to be more than one thing, and maybe the COVID virus was the straw that broke the camel's back. But typically when we start digging into health history, past even ACE scores, adverse childhood experiences, it's going to be this sort of cascade effect, this entourage effect, this perfect storm of variables that are at play. So the research shows that there's a subset of people that have COVID or had COVID, and we can call it long haulers, long COVID. Not to say every long haulers syndrome is dysautonomic, but it's a subset at the very least. And I would say that there's going to be they're going to be somewhere in the spectrum, these long hauler cases. They may not all be diagnosable as POTS and dysautonomia, but it is definitely on that continuum.
Yeah.
Because what's the mechanism of action? It's hyperinflammation. It's a dysregulated nervous system. It's mast cell release. It's excess histamines in the body. That's what's going on with pretty much every single long hauler case. Whether or not they check all the boxes of conventional medicine and say it's dysautonomia depends on the case. But the mechanism of action is typically that, no matter who you are. So what's our perspective on this? We have to see what's going on. So that's where labs, health history really can fill in the gaps here of looking at gut health, looking at histamine levels, looking at inflammation levels, looking at nervous system health, and looking at the pieces of the puzzle there. And then building a protocol based on that individual. So the context of the question, it's not, keep in mind, this is not an exhaustive list. You're not a telehealth patient. I don't know the ins and outs of your case. But we would encourage to do so, and we want to make functional medicine accessible for you for this purpose. So head on over to the Become a Patient page to learn more about this. But these are some possible tools within the toolbox for somebody with this type of umbrella of cases. So you have to, first of all, start with the basics, right? I mean,
Yes.
you have to. I want to get into the sort of the more interesting ones, but let me just not be exhaustive with this, that there's a lot of foundational things we have to come into play, like building metabolic health, building gut health, building resilience from a metabolic and gut health standpoint is paramount.
Yeah.
I won't digress because that's like obvious. Hopefully that people understand that's obvious. But what are some additional things? From a natural medicine standpoint, our clinical objective for these cases is to stabilize mast cells is a big part of that.
Yeah.
So that's going to be things like quercetin, vitamin C, boswellia. There's some really good studies. Boswellia or frankincense could be really beneficial. Aged garlic extract can be beneficial at lowering inflammation, stabilizing mast cells. Getting vitamin D3, K2 optimized, which is needed to regulate inflammation levels. The brain is rich. The nervous system is rich with these receptor sites. Turmeric is also an anti-inflammatory that can be helpful. They mentioned neuropathy as well.
Yes.
Yeah, being part of this. Higher dose phosphatidylcholine or phosphatidylcholine is another tool that we utilize for these type of cases. And then some therapies. Hyperbaric oxygen therapy or HBOT is another. HBOT can be a great tool. The small randomized control trial in 2022 was only 73 patients, but it was compelling nonetheless. Showed significant improvement in neurocognitive function and fatigue in long COVID patients, which many of those are going to have.
We see that all the time clinically.
Yeah, we can get home units for you that are like, they look like space vehicles, like a sleeping bag almost, that
but it
kind
like
of
inflates.
That make it accessible. You can be consistent. You have to be consistent with the therapies, but hyperbaric oxygen therapy can be a great tool. Ozone therapy, not a lot of robust studies looking at it, but from a biotoxin standpoint, if there's lingering bacteria, virus, mold that's triggering the immune system, I like ozone therapy when it's appropriately done as well. And then neuromodulation. So like vagal nerve stimulation is a big part of this. So somehow stimulating the autonomic nervous system to regulate it. It reduces neuroinflammation, helps to strengthen vagal tone, which is the weaker aspect. It's the parasympathetic, the resting, digesting, grounding, anti-anxiety pathway. So to fix a lot of these dysautonomic symptoms, you have to strengthen the parasympathetic. So vagal nerve stimulation is needed. And there's many ways to do that. But it could be something like breath work, some somatic practice, or it could be a device that we would integrate into your protocol. Even cold plunging, when done appropriately, can be a great way. Humming or gargling, these consistent practices that may look a bit silly sometimes, but with consistency, you're training the weak aspect of the nervous system. So those are some top things that I made notes on, but what do you guys think?
I really like frequent specific microcurrent therapy too for this. Using those microcurrents. I mean, there's a lot of research in the way that it can reduce inflammation very quickly. I mean, we've had patients even just from going 1 to 2 times have seen major differences of just reducing that inflammation, and just the impact that it's had on the nervous system as well is pretty profound. So I think that's a really cool tool that we've seen a lot of success with too.
Yeah. And this is more to the POTS component, but I mean, even you mentioned a lot of great supplements, got a lot of great therapies, but simply adding in electrolytes have been so huge for patients that are on this.
And sometimes it's an inordinate, and then maybe that's the wrong word here, but it's a lot more than people think, isn't it?
Yes. Yep. Yeah.
I would agree with that.
And so for us,
but they need more. Sorry, they need more than most people.
I was going to clarify. Yeah, what they need more than they think they need, and it's pretty crazy. You'll take patients up, and you want to monitor this. You want to be
blood
under
pressure.
Yeah, exactly. You want to make sure your blood pressure is good. You want to make sure that you're doing all the things that you're supposed to be doing. But there are times we take patients up 2, 3, 4 packs a day. Now, that might not need to be every day, but you have to think about what depletes electrolytes: your stress, poor sleep, lack of hydration, not having the proper foods. There's a lot of foods that are high in electrolytes and help with stabilizing that. So for me, it's just sometimes we're overcomplicating it. And it's just, like you said, start with the basics and see.
Yep.
You may not need to have a hyperbaric oxygen therapy in your basement. But if you do, we can layer that in. But we need to start with, well, why is your
Foundational
immune
tools,
system
yeah.
compromised in the first place? Why can some people get COVID and recover and other people have long COVID? We have to ask that simple question. And you
Sure.
have to go back and you have to say, well, what makes me more susceptible? What is my body missing that needs this support? And that's where I love our job. It feels like, I feel like a detective sometimes. And sometimes it's because they're not addressing the vagal nerve. They're a tight ball of rubber bands that's just wet, like ready to break. Or you have someone who's severely chronically dehydrated, or someone who's not sleeping well, or it's a combination of all of those things. But that's what I really enjoy about this. And so I don't want people to get discouraged and we hear long COVID or relapsing remitting Lyme, or, you know, these things that can sound really scary, but there's a reason it's happening. We just have to figure out what it is.
Yep.
And I think you mentioned a lot of great things, a lot of great tools that they can use and to be able to work on that. And I think we gave them a lot of great information.
Yeah, there was one other thing I would. Oh, it was IVIG. You'd obviously have to go to a clinic. We'd have to coordinate that. But intravenous immunoglobulins, IVIG, there was a non-randomized study in 2023 in the Journal of Internal Medicine showed some success in symptom relief, but it wasn't placebo controlled, but still some promising. And I have seen that as IVIG being a great tool that, when done appropriately, can be a great recovery piece for sure.
Absolutely. Again, layered in, looking at why it's happening and what you need to do to support your body as an entire being.
Yeah. Right. Next question.
All right, Dr. Cole. When you say a few snakes a day, what type of snake are we talking about? Garden? Tropical forest? Please elaborate.
I love this question. And she's talking
boa
about
constrictor?
poop. They're
Anaconda?
A python?
Oh my
Anaconda?
goodness. No.
Fecal anaconda?
Okay. So for anybody that doesn't understand,
Scary.
for anybody that doesn't understand the context of this question, and the way that this person wrote it out was actually kind of funny. She used emojis and everything. But when we talk about bowel movements, which people do not love to talk about most of the time, we want context for what your bowel movement looks like. And so Dr. Cole says regularly on his podcast 2 to 3 snakes a day. So for those, we now want to know what does this snake look like?
You're never going to look at a snake the same way again.
All right, I'm gonna go ahead and say it's definitely not anaconda. But
I would say
hope
this.
not. If not, set up a consult right now. Or if so,
What is
set up
she
a consult.
eating? That's what I want to know. That determines the size of the snake, for sure. Because if someone's not eating enough, sometimes we need to make a bigger snake.
So, but then to me, that at that point, that sounds like a little worm.
Yeah, definitely not.
So
No,
are we talking
garden snake can be pretty small.
Yeah.
but they can also be substantial.
I would just say a good average snake
What does
get
that
the
mean?
job done.
I can't do this.
Average snake. We need snake pictures.
Yeah.
Okay.
Send it. No, don't send it.
No,
your snake
not,
pictures.
no. I meant like actual Google snakes.
No.
not
Let
more snakes.
me
but
just say this. Let me say this. We do get poop pictures.
We do.
It's part of our job. We
It
get
is.
our email
It is.
I
inbox.
do appreciate a heads up before you send it, though.
Warn us,
Absolutely.
please.
Put it
please.
in the
Have
subject.
the common decency.
Yeah.
Attention. Snake picture.
But we do. It's part of the job. For whole reasons. People think they have parasites, and it's maybe parasites or maybe something else, mucus or something. They want we have to look at it. So we're joking about it, but it is part of our job.
Yeah.
Okay. So I don't know what type of snake. I can't answer that. But I would say, let's say if somebody doesn't have snake, what are some ways people can have 2 to 3 healthy snakes a day?
But they can
that's
also
good.
look at the Bristol scale for context as well.
Yeah, the Bristol chart is where this is actually coming from, actually.
Yeah.
So it's going to be type 3 to 4 on the Bristol chart. So you can just Google Bristol chart. Look at type 3 to 4. That's going to be smooth, snake-like poops.
And I think I think it's important, maybe not the size of the snake, but the smoothness of it, the
go.
ease of it.
There you go.
Like,
Yeah.
Yes, and
I like
that you
that.
feel like if you're completely clearing out. Some people have incomplete
Yeah.
bowel movements. That's an absolute aspect to the snakeness of the snake that we're talking about.
Not very snaky.
No. We don't want incomplete snakes. We want complete
we don't
snakes.
we don't like strips of the things.
No,
we
we
want
don't want
like
broken
a
up
full.
Yeah. Not a snake shedding its skin. We want a
Yes,
snake.
no molting.
Yeah.
No molting. Complete snake, no molting.
But it is interesting though how many people we will talk to on a daily basis when we first meet them who are not having this.
No, oh man,
Or,
it's
like,
ubiquitous to
That
say
they
the
don't
least.
know you're supposed to
So
have
this
a bowel
is such a
movement
great question.
Yes, because frequency and formation is really what we're talking about here. Because many people will have the snakes, but it'll be every 3 days, and they say, "Well, I'm fine. I'm having normal bowel movements," but it's the 2 to 3 snakes a day.
Yeah.
That's
Right.
the issue. It's not just the formation; it's the frequency of
Right.
the formation.
The amount of times people's jaws have dropped open when I told them that. Like, I mean, in
yeah.
15 and a half years, I literally can count probably on one hand the amount of people who do have normal bowel
we
movements
first
as
talked, yeah.
comparatively to
Yeah.
like, the ones that are like, wait, what do you mean a day? And I'm like, a day.
Yeah, people are
not
usually
once
shocked.
a week, a day, not every 2 to 3 days, 2 to 3 a day. And it's like this like aha moment.
Yeah.
So more people are more constipated than they realize, and I
Yeah.
think it's really
Well,
important to
because
talk
people
about.
might say, "Oh, I'm going every day," but it's incomplete or it's little like pebble-like
Yeah,
type.
I think generally America and the world is backed up.
You're backed
But
up, baby
not,
girl.
then sometimes it's not. Sometimes some people are backed up and inflamed. Some people are just flared up
And they're
inflamed.
just-
and they're
yeah.
looser stools
Yeah.
all the time. We see both. Everything
and you can
in between.
even see people who have looser bowel movements but still don't feel like a complete bowel movement. So you
Correct.
can have
Yeah.
like a combination.
Right, exactly. So IBS-C and D, the constipation, diarrhea, and then obviously we see a lot of inflammatory bowel issues like Crohn's disease and ulcerative colitis. So there's sort of the different aspects of microbiome health and gastrointestinal health is very much a big part of what we do.
Yeah.
All right, so here's some pro tips. Up fiber intake to tolerance, to digestive tolerance. Start off low and slow. But the goals, as far as the studies are concerned, is somewhere between 25 and 35 grams of fiber a day that you're getting primarily from whole foods. Things like raspberries, like 1 cup of raspberries is 8 grams. One avocado is about 10 grams.
Yeah.
2 tablespoons of chia seeds, 10 grams. So there's different, like, broccoli fibers can be like increasing fruits and vegetables as a whole is a great way to up the amount of grams of fiber. But not all fiber is the same. We've covered this in past episodes.
Yeah.
Soluble, insoluble, fermentable, not fermentable. There's definitely a lot of nuance and bioindividuality to this, that if it's causing bloating, if it's causing distension, if it's causing a flare-up, it's not the fiber's fault per se most of the time if it's coming from fruits and vegetables primarily, but it's something you have to meet your gut where it's at. And oftentimes if there's SIBO, small intestinal bacterial overgrowth, or FODMAP intolerance, there's we have to be judicious with fiber. But the goal is improve resilience over time to tolerance, increase fiber over time, because the more diverse your fiber is, that's prebiotics for the probiotics to make postbiotics, which is needed for a healthy immune system and mitophagy, mitochondrial autophagy, lots of different things. So fiber is a part of that. Polyphenols are another part of that too. So increasing polyphenol-rich foods are another way to help with healthy microbiome health. Probiotic-rich foods, fermented foods are another great way to increase those snakes a day. Have a little snake party.
Oh boy.
And magnesium supplementation is another great tool.
Yes.
I would say I don't love it as a dependency, and I certainly don't love magnesium supplementation when it is creating looser stools.
Right.
And people
right.
that are chronically constipated get kind of
balance.
addicted to, at least they're going, and it's like looser all the time.
Yeah.
And I use the word addictive loosely. It's not an actual addiction, but you know what I mean. They can become sort of obsessed.
Well, it's the first time that they're getting relief, so
Yeah.
it's easy to like latch on to something like that.
But yeah, we remember 2 to 3 snakes a day. We can't have like pudding every day. Is
Yeah.
that good? Soft serve ice cream.
Oh,
You're
don't ruin ice cream.
Actually ruining this for me
Don't.
now.
You can't do that and that's irritating to the gut.
Yeah.
I mean, it's like you're taking something that could be a great tool and you're just overdoing it. So judicious use of this. If you're overcorrecting going into soft serve ice cream land, it's not good. Squatty potties. Don't sleep on the squatty
Gosh,
potties.
everybody
Sleep on
needs a
it.
squatty potty. And if
If you don't know what it is, you're
explain
putting
what is squatty potty.
it's like a sort of plastic.
Well, you can get wooden one. Yeah, you can get different materials.
Wooden, right? Some eco-friendly, right? Squatty potty, where you're putting your feet on the toilet. When you're on the toilet, you're putting your feet up so your knees are like raised up a bit
It's
higher.
almost like you're squatting down.
Yeah, it's more of a primal position that humans
like
would
your
have
pelvic
gone to the
floor,
bathroom
yeah.
in.
Yeah.
So yes, the pelvic floor, the intestines, the ergonomically, biomechanically, you are going to be in a better position to have 2 to 3 snakes a day.
Yep.
Complete snakes a day. And then abdominal massage can be a great tool for people. So yeah, those are some ideas that I like. Anything else I missed?
No, I actually think you hit on everything that I would have normally said.
Great.
Yeah.
Okay.
We love it.
Great. What's the next question?
All right, Dr. Cole, last and final question. Can severe anemia cause high A1C even when someone is metabolically healthy and doesn't have insulin resistance?
The answer is yes. Iron is needed for every cell of your body. It's needed for cellular energy production, oxygenation of our cells. So on a cellular health level, iron is needed. From a functional medicine perspective, it is actually, from an order of operation standpoint, it's one of the first things we need to get optimized. We don't need it perfect, but we need to at least be trending in the right direction to make everything else we want to do happen more unimpededly. So we have to look at a full iron panel: iron saturation, hemoglobin, hematocrit, what's called an MC series, or basically red blood cell measurements, iron saturation, ferritin, stored iron. Did I mention everything? Total iron binding capacity.
Yeah,
I think I mentioned everything. So that's what's called a full comprehensive iron panel. And it's going to be a few different test codes that you'd have to run. You're not going to get all of that on most labs. You're going to have to run several tests to kind of look at the full context of how significant is this going to be. But iron deficiency anemia, or just maybe even functionally low iron, will absolutely impact A1C. A1C is about a 2 to 3 month average of someone's blood sugar, and it's very much dependent on red blood cell health. So if your body has slowed down production of red blood cells, and you have older red blood cells in the system because of iron deficiency, that's more time for those red blood cells to absorb more glucose. So that can artificially inflate, or you can say inflate, their A1C. And there's several studies to show that. This was a study in the Journal of Egypt Public Health Association in non-diabetic patients with iron deficiency anemia. A1C levels were significantly higher, a mean of 7.6%, than in controls of 5.5. After iron supplementation, it was ferrous sulfate at 325 milligrams daily for 8 weeks, A1C decreased significantly, a mean of 6.2. Get this, without changes in fasting glucose. Suggesting iron deficiency anemia directly inflates A1C. And there's other studies that show that, is that if somebody's insulin resistant and iron deficiency anemia, and it can definitely, I could see this exacerbating insulin resistance. If your body's not getting nutrients in, if it's oxidative, if it's irritating to the body, if the body is stressed out because of a lack of iron, I guess would be a good way of putting it. That's going to only exacerbate insulin resistance. It's not necessarily going to cause it, but it's going to be an aggravant, kind of got gasoline on the fire, and certainly impede healing and recovery and optimization.
Yeah.
But they are two separate things. And if you look at just A1C, you could definitely see a higher A1C if someone has iron deficiency anemia, regardless of their insulin resistance status. So sometimes we have to deal with both, of improving insulin resistance and iron optimization. And for some people, they see their A1C higher, and it's solely due to the IDA, the iron deficiency anemia, and they may not have insulin resistance at all. So we want to look at the context of these numbers and dose accordingly. The lower their numbers are, the more we're going to have to be ample and appropriate with the iron supplementation. Starting with food is first, obviously. The heme iron, these bioavailable sources of iron as far as grass-fed beef and organ meats, and even plant-based sources can be great too. Bringing in vitamin C into the protocol, which enhances bioavailability of iron. These are things that we're going to be appropriately integrating into somebody's protocol. With that said, the bigger question is, why is the iron deficiencies there in the first place? So that's looking at for women that have heavy periods or just prolonged heavy periods. Maybe they don't even think it's very heavy is what I'm trying to say. But it's just they've had a period that's on the heavier side for years and years and years. And then they've not dealt with the nutrient like enrichment that's needed.
Yeah.
Or it could be very heavy periods. We see a lot of endometriosis and adenomyosis and PCOS. It really can throw off the cycles and make them very heavy. So we're going to have to deal with the hormonal imbalance in those cases. Or is it a microbleed in the gut? Is it because of some inflammatory bowel issue that's slowly depleting iron that way? So there's a lot of things
Lack
that
of
can
eating it in their nutritional diet.
or just a
there's a lot of that.
a deficient nutrient-less diet could be that as well.
Yeah.
And that's easier to fix, right? That's easier to
100%.
fix. But there's a hormonal layer to it that we have to deal with that. Because why do you have the problem in the first place? Yes, we can replenish it, but are you depleting what we're replenishing? And that's the question there.
Yeah, we're not absorbing it, right?
That's another good point. Is that we aren't just what we eat and supplement with, we are what we absorb. So if you aren't improving gut health resilience, the supplements or the foods you're taking in aren't going to be, it's going to be an uphill battle to say the least. If there's a time and place for iron infusions, when it's properly monitored, and sometimes that gets the number up quicker when it's needed to do so. But is it just a flash in the pan and you're not going to stabilize? We need to stabilize. It's not just about getting the number up on a snapshot in time. It's about stabilization over time because your body needs it, your mitochondria needs it, your cellular energy needs iron.
I agree.
But more isn't always better. That's the key. It's oxidative. It's bringing oxygen. Too much iron is oxidative. So by all means, you need to be, if you're supplementing on your own, if you're eating a high iron diet to get the number up, you have to get your numbers tested. Because you don't want, more is not better when it comes to iron levels. It's inflammatory. Too much of a good thing.
100%.
All right. Anything else?
No, that's all I have.
That's good.
All right, my friends. Oh, and I didn't say this, but
our little Easter eggs that we're going to start
we're
putting.
We're going to start doing Art of Being Well Easter eggs for those that watch the reels on TikTok and Instagram and watch the full episodes on YouTube. I'm going to start putting random drinks in the episodes of things that I normally just drink walking around here at the telehealth center. So this is a big old... What do you call this? Jug of aloe juice, whole leaf aloe juice. I literally, the serving size is just like having like 1 to 2 ounces a day. I definitely don't do that.
No, you have way more.
I am like macro dosing the heck out of the aloe juice.
That one's good though. I have that one at home.
Oh, you do?
Yeah.
Okay. Then this 365 brand, which is the generic brand. I sometimes will have that, like a Whole Foods generic brand, but I love this one. They're not sponsored. It's Lily of the Desert. I've honestly drank this since I was a kid. That's how weird I am. Like probably 14 years old, I would drink this, and it's just this thing that's really good.
I'm not surprised anymore.
No. One of my favorite stories is for people who don't know, Will and I are related.
What?
And, yeah.
I don't think we've ever said that in the podcast.
Oh my
I think
gosh.
we have.
Everyone's
we
surprised.
have like a long time ago, but it's been a long time. So
let me just say this: is nepotism does not involve. There's no nepotism at the clinic. She's highly trained. I've worked with her for 15 years.
Yeah, you actually, I wasn't supposed to be permanent. I was going to finish up my law degree, and here we are.
Here we are.
But
she went from law to health. It happens.
Yeah. And so, but one of my favorite stories about grandma is how, since you were a young child, your aloe and
what are
then
you going to share? I'm nervous.
It's very sweet. It's actually super sweet. She remembers going on cruises with you and your family, and she would always talk about how all the kids would go and get all the desserts and bring all of these things back to the table, and there you would be with your big giant pile of green grapes.
Oh, green grapes.
Grandma's in heaven. Eating all the green grapes she wants.
And they're nice and firm, and they're
cold.
not soggy, and they're cold.
They're definitely cold.
Oh, they're definitely cold grapes in heaven. None of that lukewarm shit.
You came by it honestly.
The weird wellness things go back in time.
They go way back.
They go back in time. But what grape would you be?
Oh, okay. this is a great question. I used to be a green grape girl, but I've since switched. Now it still has to be cold, crispy grapes.
That's right.
Okay, and
Temperature matters.
So
it's all that's there.
Can
is
we
green,
all
I will
agree
have
on
it.
that? Regardless of anything, it has to be cold, not room
Absolutely.
temperature, not sort of cold.
I mean, I
cold.
won't. I'm just saying, like, if I'm on an island,
You're gonna
and
eat.
all I have is room temperature grapes.
You're gonna eat them.
I'm not that above it, but it definitely
you
is not
leave-
the same experience.
Yeah, if you leave
No.
your grapes out just for fun, who are
they
you?
lose their firmness. And they do. There's something about it. Other fruits don't have this phenomenon like as much. Like I can have a room temperature pear. I actually think I would prefer a room
See,
temperature
I
pear.
like all of my fruit cold.
Me too.
All
I
of it,
put them
other
all-
bananas.
I put my bananas in the fridge.
Oh, interesting. Oh,
Okay,
a cold,
let us know.
like, underripe-
Let us know. Comment section wherever you're seeing this video or sound. Let us know. How do you prefer your fruits? What's that look like?
We could do frozen, refrigerated, cold, or
Or
room,
room temp.
temperature. Those are like
Yeah.
the three options.
Frozen grapes are good too.
There's something about the texture.
No, it's like a chalkboard.
Yeah. But anyways, these Easter eggs, this is going to be, we haven't decided on what type of prize you're going to win yet, but we're going to come up with one. If you can keep track of all of Will's different drinks that he has, so go on YouTube, go watch this in one of our clips or in one of the
on
videos.
Instagram or TikTok.
Will is going to have different drinks on the table today.
And then
giving
me,
you a freebie.
I
Today's
manage
aloe.
like my channel, and Brooke, she manages social and the Art of Being Well pages. Yeah, let us know.
We'll come up with something
we'll
if
come
you
up
can
with
keep
something.
track of all
but
of
today
Will's
it
prize.
is this beautiful aloe juice.
We're saying it out
Do you
loud
guys like
today.
aloe juice?
I love aloe juice.
Love
I have
aloe
some in my
juice.
fridge. I like that brand too.
Oh, okay, cool. Yeah.
When we
I love
went
it.
on our most recent trip, I actually stopped at a whole it's you know what it is, Urban Market.
Yeah, in
and
Franklin, Tennessee.
Yeah, in Franklin, Tennessee. And one of the things I bought for our hotel room was aloe juice. So I am that weird person too.
Yeah.
I get it.
It's a requirement to work here. All right, guys. If you want to learn more about our clinical work, the Telehealth Center, there's so much free resources that are a companion to the podcast. Check it out at drwillcole.com. We'll see you next time.